September 8th, and the Board of Health meeting. And since we do not have a quorum, we are going to meet for an informational meeting, and we get started.
Okay, we'll skip over the minutes since we can't approve them. Just some of the activities of this past 3 weeks since our special meeting in August. I did have the opportunity to meet with the Planning and Zoning Director and the Zoning Enforcement Officer to talk about, this is the season of Fairfield Beach Road and all the overcrowding complaints, and so had a chance to meet with those individuals and talk about, alternative enforcement pathways. So we'll be looking into that. Recently, zoning has been given citation authority, which is a $150 a day fine, and they would have a local hearing, which would be, expedited much more than the traditional path of us saying an order. They typically appeal it to Hartford. We get a hearing 2 months later, and if we're successful, then we take them to court here and start the process of enforcement. So it has the potential to be a more efficient process. So we're looking at that. I did meet with the town attorney to talk about utilization of that, for enforcement, and he felt like it's consistent with the intent of it, and it's since the limit on unrelated individuals in the beach area is a zoning regulation that it's perfectly appropriate to use it. And then I did have a chance to meet with 2 of the heads of the associations of the Fairfield Beach Road area associations and talk about, they're new, or one of them is newer to being in leadership. And so talked about how it works and, how we typically do enforcement and, how they can help out with that. And so we're looking at doing that. We've had, I think we had 1 or 2 sort of allegations of it, but we're kind of taking a look and see, but it's kind of early where there's not a lot of demands on the students quite yet. And so lots of people come down to the beach for overnight visits and the like. So, but I think we'll be getting a few complaints soon. I got an email from somebody with, how can I complain about, these properties, and sent pictures of cars. So this will be the season of that. We'll be working on that. Did have a chance to meet with Kristen McCarthy-Vahey, our state rep, and a local resident who has been having an issue with at a residential facility and some struggles there with getting, some infestation issues, and they're having trouble resolving it, and so we ended up issuing an order to sort of put some pressure on them to more aggressively address the issue. So hopefully that'll be successful. And I think everybody was satisfied with the meeting, and so we're looking forward to trying to get that a little bit more successful. I don't know if I shared last month, but I'd shared a couple months back that we had an individual arrested for failure to comply with one of our orders, and we were able to resolve that successfully over the summer. So I don't think I shared that last time, but it was unfortunate, but we were able to put enough pressure on where they finally took care of the issue. It's not perfect, but it's improved, and so we this past week we had a department head meeting where they've talked about several new policies that they're rolling out. We're continuing to work on Paycom, and it's Santino will attest. It's adds a lot to your workday in terms of just having to sort of, it's a daily thing now as opposed to once a week, and checking things and correcting punch outs and punch pairs and deleting pairs and change requests and stuff. So it's still a big learning curve that's added. I think it'll be an improvement, and it really does put the employee as responsible for entering and maintaining their time records, and so we think it'll be improvement. We do have a new public works director that they announced. So we've had sort of an interim public works director for 4 or 5 years, and so it's good to have a new person in that. Have continued to be a part of the CDC calls. The measles outbreak in Texas and Oklahoma has been declared over. There's still 6 smaller outbreaks in 7 states, involving 7 states. There's still 4,000 cases in Canada, 5,000 cases in Mexico. So that's still, percolating, but we're still having importation cases. And we did have, just for a note of interest, a case of malaria in New Jersey and Washington State, 2 cases of locally acquired malaria, not travel associated. So it's interesting. It's not unique. I mean, there's every now and then a few cases, but it's been a while since we've had some. And then I just thought I would show, here's what's going on in terms of respiratory viruses, with influenza being relative background levels very low, RSV still very low, and you can see the typical September kind of wave starting to happen now. So we'll see what happens as we go through the season. Nothing in like the wastewater surveillance isn't showing anything. We're still down low. The light blue is concentration wastewater. The dark blue is hospitalizations. So they kind of match. They follow each other, but nothing significant going on there. So, but that's what's going on with COVID. So we'll see. But really, that is it. It's been, a quick 3 weeks since our last meeting. So.
Yeah. All right. So last week we helped Fairfield Cares with their week of action. So on September 3rd, they had a health expo over at the Senior Center. And actually, Emma Sharp and myself were Narcan trained during the health expo. So we had a table, and then they had some Narcan training that we were able to sit on and get trained with the first Select Women as well. So that was great. And then on September 4th, there was the overdose awareness vigil. So Sands, Emma, myself, we were all there. The state reps and some members of the public, and the first Select Woman. And it was a nice night to just kind of remember all of those that struggle with opioid abuse. Talking about flu clinics, so we're hoping to go live tomorrow. Individuals will be able to make appointments at public health nursing between the hours of 10 and 2 on the days that our public health nurse is there to come in and get the flu shot. But in addition to that, October 1st is going to be our senior clinic from 10 a.m. to 2 p.m. over at the Senior Center. And we will also offer COVID for them as well. So it'll be a flu and a COVID.
High dose flu.
High dose, yeah. And we will have the regular dose as well. But yeah, we're really focusing on the high dose and COVID for those over the age of 65. And then October 15th and 16th, again, at the Senior Center in the gym from 11 a.m. to 7 p.m. And that will be our big general population. That will be flu only. Because of the volume that we tend to do, we don't want to get too many vaccines going at the same time. We're also going to be offering pneumonia and RSV this year for those over the age of 75. So we did it last year. We did 6 doses of pneumonia, and we did 10 doses of RSV. So we're going to do that again this year. Sam sent me an email that our annual report is due to DPH on December 5th. So Mary Cannon and I will start getting that all together. And so they just basically ask, like, the activities that we've done throughout the year, our challenges, the successes, how many people are employed. So, it's a little time consuming, but we'll get working on that and make sure we have it in by December 5th. Someone from Fairfield U reached out to me today asking for QPR training. So I'm really excited because we did it at Sacred Heart last year a few times. I believe this is for the nurses at the health center, but I'm really excited to get in there, and then hopefully we can try to set something up for the students. In our social media, we've really been promoting the Safe Streets initiative, childhood vaccines, and, we're still putting some information out there on ticks. And then the biggest thing is we met with our HIA, which is our Health Improvement Alliance partners. That includes the hospitals and the local health departments on the 2025 Community Health Needs Assessment, because they're gonna launch the CHIP, the Community Health Improvement Plan, on September 23rd. That will guide kind of our activities. And the biggest takeaway is we're going from a needs-based approach to a strategy-based approach. So looking at the 3 priority areas of mental well-being, preventative care, and quality of life, and strengthening our communities. And then the strategies are outreach and screening, education and training, resource development, and advocacy. So that's just kind of what we've been working on. So it's a little bit of a change. We're going to try that change for about 12 months and see if that's kind of where the group has been going. And then we'll reassess in a year.
What were the 3 areas? Mental well-being.
Mental well-being, preventative care and quality of life, and strengthening communities.
Great.
Yep.
Mm-hmm.
So the hospitals are going to the hospital board, I think this week and next week for their CHIP approvals, and then we'll get that. Yep, and that's it.
Okay.
Thank you.
Mm-hmm.
Well, we've got nothing else.
Is there anything that you want us to help share, promote?
Probably once we have flyers for the flu clinic, maybe I'll send it out to the board, and you can help disseminate that. We have a few mock flyers. I was just waiting for some confirmation from the senior center. And then Julie McCullough, our public health nurse, will be in on Wednesday. So once everything is, all set, we'll send that out.
Okay.
You said the date for the major flu clinic is what day?
15th and 16th, October 15th and 16th, 11 a.m. to 7 p.m.
And the first is for the seniors.
Yep, the October 1st is really for seniors. So that one we'll only really publicize at the senior center,
Right.
and they put it in the newsletter. But it's the 15th and 16th that are our big ones. And actually the 15th is a half day at school.
Oh, that's a great time.
Yeah, and so we figured both days until 7 o'clock, this way either before activities or after activities, and really try to get that group.
Okay, great.
So we'll have earplugs for the
Experience
for the screen
lollipop.
kids.
How many people are trained, do you know?
How many people have we trained?
Or that can give the training?
So in our office, it's me, Julie McCullough, our public health nurse, and one of our nurses.
And do you know if any other folks in the town are?
Not to my knowledge. Mm-hmm.
Great.
Yeah, and we've done quite a bit out in the community, and we trained employees here, and they're usually really well attended.
Yeah.
And we did a bunch last winter and in the spring at Sacred Heart University. And by a bunch, I do mean 3. I think it was 3 or 4.
That's a lot.
But and it was great.
Yeah.
And we were packed at every single one, and
Great.
there are evening ones, and you always say, oh, an evening thing, totally worth my time.
That's
You
great.
have 25 students who are not looking at their phones, who are 100% engaged,
Mhm.
and it's just so rewarding.
Yeah.
So we're excited that Fairfield U wants to have us come in.
Great.
Yeah.
Mhm.
So once we finalize the date, I'll let you guys know.
Great.
Okay.
There's nothing else.
That is it. That's all we have. No big approvals for tonight, and we couldn't approve them anyway if we did. But
Yeah, sorry I was late. I was in Danbury presenting some data.
well, thank you, everyone.
Thank you.
Yeah, well, the only thing that I see on the forecast, that the board will be involved in is at some point, either this fall, we'll be doing a new strategic plan. So we'll be looking to bring in a consultant, and depending on when that happens, we'll probably have a session, I'll ask Jason to sort of dedicate a session for that purpose, so we can get input from-
Within our normal meeting time or an extra?
Yeah.
Okay.
I think, we'd either have a shortened meeting, with only sort of essential voting things, and then have that as a, sort of a focus group, for the Board of Health to kind of, yield, input for the strategic plan. But we're gonna wait till the chip comes out and kind of review that data. We've got the Data Haven data, and so.
Do you have Data Haven for Fairfield only?
We do, yeah. We have like the crosstabs
Yeah.
that they provide,
Yeah.
so,
That's great.
yeah, it's really good. And we have, what they call the Community-Based Asset Survey, was it? The CBANS?
Mm-hmm.
Assets and Needs Survey, which was a sort of convenience sample. So you just posted it on websites, and we had people do it, and we
Yeah.
collected, what was the number? 1,200, 1,500?
Almost 1,500.
For
That's great.
Fairfield?
Just Fairfield,
Holy-
yeah. So it's a subset
The
of the,
most in the state.
yes.
Wow.
Yes.
That's really
Yeah.
Very
impressive.
proud. Yeah.
So we want to pull that data in. It's a subset of the questions of the Data
Sure.
Haven survey,
Yeah.
designed to give sort of local
Sure.
qualitative data,
Yeah.
to add to the,
Yeah,
sort
you
of
did a
picture.
really nice job of promoting that and
Well, that's
getting
amazing.
that out,
Yep.
yeah.
As somebody who does that for a living, it's a great
Yeah.
response.
We
Yes,
were shocked.
incredible.
Yes.
We were shocked.
And you didn't give him anything either, right?
We honestly want our admin at the public health nursing office. She was on the board of ed, and so she sent it through
I think that's what
the
you
school
Yeah.
district, and like
Yeah,
that's just where
I
the
think that's
numbers
how I got
kind
it.
of.
But we did, like, to not diminish what Santina did was, every elected official,
Yeah.
every RTM member, every,
Yeah.
Board of Finance, every commission member around, everybody elected
Yeah.
statewide.
It was all over the place.
Yeah,
Yeah.
and we were
Yeah.
also in the community. So Emma Sharp and Chloe, who's no longer with us, they were at the library for hours, doing it with, people, doing it with the seniors, even on
Yeah.
pen and paper, and then go ahead and input in the data. 'Cause-
Did you write down your process of who you went to before?
Yeah.
Okay, good.
Mhm.
So that you can
Yes,
go back out. Who did we talk to?
Yeah.
So we want to have the consultant review that data
Yeah.
and kind of pull all that in to sort of guide the process and have it be, lead us for the next couple of years.
Yeah. Great.
Awesome.
All right.
Great.
You want to turn the recording off or?
Brilliant.
Yep.
All right, so meeting adjourned 7:55.